in this one town without any change in the other town. And remember, these borders are very porous. So like for sure, people were coming, but just because the training was centered in this one town and they got it out so well, it's really legendary.
We do have parents driving to Massachusetts and Rhode Island in this county.
But I guess so what instructions do you give when you give it to, that's, again, I'm not quite sure, because the person, is it given sort of, it's for overdose use, so
Yeah.
is the person themselves probably is not going to
No, it's a life now.
basically if somebody finds them and they're sort of out of it.
Yeah, and it's an autofilled syringe and you put it in their nose and shoot it in. And so I can get in Massachusetts. There's a group called Learn to Cope, which is just a nonprofit organization run by a mom whose kid had an opioid addiction, and she's built this amazing network where it's kind of like it's analogous in some ways, very different from AA, but it's that kind of self-help group, and they meet every single day of the week, and once a month they'll give a training, and so we send all the parents to go get trained.
Actually, there's a derivative in New Hampshire and Farmington. I have the materials. The woman modeled it after the one in Massachusetts, and it seems she's great.
Minus the Narcan. That distributes the Narcan, so that is the difference between, we're going to bring Learn to Cope up, but we just need the legislation.
Right. No, I'm
So
speaking.
again,
You can see that I'm a passionate advocate.
So again, is that something that that's probably something that could also get teams that are sort of using to sort of understand how serious you take it. If you say, well, I think you need this prescription just in case you end up having overdose.
Right. So we actually do use that clinically for kids. So this is like a sort of
So you're sort of saying, I don't think you should be doing this, but just in case you do, you continue to, and you overdose, here's something that can save your life. And
Right. So the way I use it clinically is for kids. There are kids who you just know they've relapsed, but they're not being honest with you, and they're giving you cold urine samples, and they're and they have every red flag, but they're just and then at some point I say to kids, I just don't think that Suboxone is really working for you right now. I do want you to have this Narcan just in case. I really care about you, and I can get you to a higher level of care if you're interested, and then we can try again. We'll talk to them like that, but we could give them Narcan at that time. And that, yeah, it's to give a message, but it's not really meant to scare them. It's, I really want them to have it,
Yep.
So your Suboxone program for adolescents is right in the 12-week program? Is that what I was
Is
hearing?
it covered? I'm sorry?
Is it a 12-week program?
No. We treat kids for years.
For years,
Yeah. But they get real stable. My oldest patient, who I think is now in his early 30s, he comes in once a quarter and has been doing so for the past 5 or 6 years, and he gets like he's what we do. Nobody knows how long to keep patients on Suboxone, right? But what we do is when they've been drug-free for a year, we ask them if they want to taper, and then we just start tapering. And if they complain the cravings are coming back, we stop tapering. We leave them on that, we leave them on the last lowest dose where they weren't having cravings. We just leave them. And if they go another year, then we'll taper them again. So we've had kids who've been doing it for years and years, but we have kids who have not used any drugs in all of that time. So, I think of that as a major success. And if they decide to stay on Suboxone, that's okay with me. I've had lots of kids come off successfully. I have kids who...
But you're not going 12 weeks and then...
No, I think that's
it.
No, that's just how the
That was
study
the
was
study,
done.
wasn't it?
Yeah, I was just reporting the study.
Yeah.
Even the person who ran the study didn't want to do it that way, but that's the study he had funded.
Isn't that, Sharon, that often people, because folks are unwilling to treat, especially younger people, longer term, with medication, that a lot of time it's seen as just for their detox and early treatment. Let's get you stable, and that's sometimes where that 12-week thing comes from. It's kind of that 3-month window of, we're going to get them all cleaned up and then they'll be cured.
Right.
And there's no evidence that it works like that.
Right.
It
In fact,
doesn't work
there's
that
a lot of
way.
evidence that it doesn't.
But there's still that notion, and we certainly will hear that from insurance companies and other people.
And what we did was in December 18th, we were bringing in, as I mentioned, a primary care provider who is an MMT prescriber. So he will answer your questions and just talk it through whether or not we want to go in that direction.
MAT meaning
Medication-assisted therapy.
Suboxone.
It can be Suboxone, it can be,
It could be Vivitrol.
Vivitrol for alcohol, it
Or
can
for
be
opioids.
tobacco. I mean, it's an umbrella, but it is Suboxone.
But-
And it's in primary care.
And I'll tell you, so, you know, I've asked the AAP to take up as part of their, as part of their legislative agenda to get rid of the waiver, because the waiver puts this aura around, like, oh my God, it's so hard, and how could I possibly, it's like, no, it's the easiest prescription you'll ever write, because hardly anything, I mean, other than alcohol and benzos, hardly any drug-drug interactions. Even alcohol and benzos, I mean, you're still better off with Suboxone than heroin, if that's what they're doing, right? So, there's really,
The waiver meaning the
You have to
extra DEA type of
yeah,
certification.
it's no big deal, it's 8 hours of training, but I think it sends the wrong message of like, wow, this must be incredibly complex. It's not, it's very easy to do, actually.
And you can carry 30 in the first year and 100 thereafter.
Yeah.
So, can you guys do your evals, and leave them just on the table and we'll collect them, and make sure you grab a couple plates to bring them down if you're so inclined.
Parents
Yeah.
who are very.
So, after talking to the latest
Because
patient,
they, whatever,
who's been on
that was just during the summer and I was in school and he's not. And I'm like, what? You're having difficulty sleeping, let's talk about that versus like smoking
It's
pot.
also,
Yeah,
I think the
so, I
issue
mean,
is
certainly-
whether.
just heard too many
Some of
good
this may
stories.
Well, because
So,
he's been abstinent.
Yeah.
and was having a-
You know what we've done, we've written, well, it's gonna be a little while before it's published, but we, I recognize.
from
that
3 or
this
4
year
people in
we've
the last
written,
year, that was
clinical
really
guidance
powerful.
on behalf of the American Academy of
Painkillers
Pediatrics,
and stuff,
Thanks.
and families, and
Or
these are legalized marijuana, and just really going over some.
Okay.
That's the primary, that is the
And I
only
think-
Suboxone clinic
No,
locally.
it's just not
for us.
right.
I thought it was
Terrifying.
one
There are- I mean, you can't, it seems like
Well,
you can't
I'm
really,
not
you can't
saying
really,
that.
so many of the parents are gonna give you one that they
But I have a feeling
And
they'll
this is
cease medicating.
absolutely not
That's,
right.
I'll put money on it.
Yeah, and
I know one
kind of got
company,
me
they're
down
not
where
doing
they are,
business,
because
so
if you come with a
I don't
very
think we're gonna
strong
have-
message, they'll just ignore you,
I don't know, I just,
you know.
but I'm gonna be sucker, so we'll talk about it. And
Yeah.
I think
But-
the biggest thing too is the financing.
Okay,
We want
well,
to be uninsured.
I mean, which is not
How do we- how do they
surprising.
get their
Like,
prescription?
like, I spilled
They
five
have no
there,
insurance,
fine.
and that's something we're gonna have to, that's why
But
I'm
the same
saying
thing.
Aaron about it's expensive.
Really?
Just-
How about
Just
this
the flavor
set up?
of it.
Yeah.
Like, right, is it twice
I know, but
It's a moneymaker.
It's a moneymaker. It's a moneymaker for the providers. That is the generic. That is the generic.
I don't know, that must
It's
be
also like not the
It has something to do with their
It's
patent.
not the same
What's
as
that? It was
There's only
like-
one
It certainly doesn't,
maker of
because,
the generic,
you know,
they can
the-
still name their
if you
price.
look
I mean, you have to have
at,
competition come in, multiple
It
generics
was
to be able to.
2001, the average
So, there's a lot of variables.
Price
marijuana was 4%,
Maybe
now
we
it's
can't- we're not
well
just
over
gonna see
9%,
insured
some
people.
medical
We're not just gonna
marijuana,
see-
it's
Well,
like
but the other thing
8%.
is.
And then there are people
how
using
much
like
they're
pure
spending for whatever they
hash
get.
oil, like that's
Is it
pure
more expensive,
drugs.
is it more
Right,
expensive than drugs?
anything
I mean,
above, I
that's-
think it's like
I mean, that's
8%
really
was
what it is.
alcohol and it's
Well,
all
Medicaid
right,
covers
because
it, it'll be just.
it's a
No,
really
it'll
hard
be,
drug.
EP will cover it, not
So,
Medicaid.
you know, this is not
But,
the
you
same
know, I
substance
mean, heroin
as,
is cheap, but it's not cheap in
There,
America.
it is.
You know, I think
it's
just
cheap
the
on
analogy
pot.
with tobacco.
Yeah, but they're not
the
paying
truth of the matter is
with
you're
the
gonna take, well,
HTP is still not paying.
American,
Unless
Native
it's,
Americans,
unless they have a
they
trust.
smoked tobacco for
The
generations.
HTP is the New
And the truth
Hampshire,
of the matter is they did, and it
extension.
wasn't
They
nearly
won't
so
pay
harmful
for,
as
they will not pay to get
the
Suboxone.
products
It will
that
cover
we
it.
put together,
That will
right?
cover it.
And I think
It's the
people-
traditional
So the
Medicare.
point is, the patient doesn't have to pay anything
Are
anyway.
they?
If they're insured,
If
if they're uninsured because they didn't turn their paperwork in or whatever the case is.
It's
or
a
if
lot,
they-
I think
if
it's
they-
a point
If they were pregnant, they were on traditional Medicaid, and just because they deliver, then they go to the, they transition over to
I mean,
HTP.
you know,
There's
that's
a lag
the
there.
large drug
That's all the
cartels
things that
are
Aaron and I are trying to figure out. We're just,
organizations
it's a maze.
have
And I'm not
specifically
And
drafted
do they not cover the,
up in the
they don't cover the
THC, and so
visits,
all
or they don't
these-
cover
The
the,
medication, it's the medication. I'm less concerned with business. I can get grants for your guys' time. I can do that. It's, I'm talking about, we give them a prescription and we can fill it.
yes, how expensive
That there's
So are we talking
no-
adolescents, or are we talking?
But the biggest argument and
Well,
the
it's
absolute best
me,
argument
adolescents,
with
I'm talking to middle.
Yeah, I think we
They all
gotta
are.
start somewhere.
that is
Exactly.
about
We can't.
I'm meeting with Aaron about this.
you know, cost.
So I will ask.
It's like
And
twice the
about-
cost of
You know, that's
methadone.
great, but
So methadone is
the
about
last time you saw
$5
it
a week,
was,
Suboxone would be like around
in
1.
expensive.
the last 10 years, it's still.
It's already done it, it's one of the only prescribers too.
Different stuff,
So I don't know.
literally a different.
But we're gonna look at all this.
And by the way, all the
So do
research
we need to
behind
personally
the
get
impacts of marijuana.
certified for
How do you
this
get it? But I'm not
on?
So that's for 32 milligrams a day.
Practice. You
Even
guys
more,
have to
and
get
just
really
relying people
32
on,
milligrams a
you
day.
know,
I don't wanna just like
think
do
about
it.
tobacco.
Dr.
That
Tyson
was-
That's
must
probably
do.
what most people
Yeah.
are
Sorry,
saying.
yeah, Dr.
It's like
Guarino is definitely.
millions
Most
of lives.
Yeah.
Millions of
They
lives.
like taking
Yeah.
it.
Yeah.
And that's not because these are
They
things
come on
that we-
treatment on
because,
30
you know, these exposure.
But, and then the point is how to.
And I wonder if it's like
It's
methadone, if they
outpatient.
still
I don't
want
wanna
to
ask
the
you
same
to
amount
say
of
not
prescribers.
complex.
Go recommended by
Not because they're not
opioids.
there,
Methadone
but
fix
wrong.
is the
And
same
starts
rate.
Oh, yeah.
Yeah, $180,
That's what
that's
we
what
need.
they
Oh, yeah.
have to do.
We're gonna build it.
Or regardless, maybe with the doses.
Oh, my goodness.
So,
Thanks
there's a
for,
lot
thanks for your
going
attention.
on.
It's a long
You
way.
have to have the
In my
driver's
brain.
screening and all that.
Oh,
good.
any labs
Good,
that
good.
we are, we have to have really
Good.
good screening.
Glad you like that.
So, thank you for coming today.
I think we need to have this screening with their colleagues.
We talked to guys previously,
Oh, no, we're
about
not.
PBS stuff, and it's a little up in the
I
air.
have this.
You're hoping that.
We're all for it, except he is, yeah, because it's, I don't know if Mike was.
Okay, I don't think I've heard about that yet.
Pretty
Do you have a
neat.
date in January?
It has
It's not on
been
my-
issued.
tell you it's not on my calendar.
Colleen's going to meet with, she's actually on at the start of the thing.
Not doing the same thing.
Welcome.
They do, that'll be very helpful, and then they're having a huge meeting with the methadone coordination.
Kathy,
You know, it's
Smith is
very,
being
very
She's
close.
meeting
I
with
have
guys.
methadone
She's gonna
coordination.
get ready.
One word smells like.
assessments and everything stuff, this.
Yeah. That would be preferable.
Responsibility.
They had another baby.